Hello, I'm Dr. Tracy McClellan, founder and CEO of the Medical Institute of South Georgia. If you are sitting and watching this video, that means that you made it to this class, NeuroSafe Training at the Medical Institute of South Georgia. Give yourselves a big round of applause. Welcome aboard. By now, you should have already completed your orientation for the school. You should have already completed your enrollment. And now it's time to get to work. So today we're going to dive right into what's going to be happening over the next couple of weeks. I'm going to push you very hard, and all I need you to do is accept the push and move as I'm pushing you to your greatness. So today we're going to start off by looking at the syllabus for the course so that you will have what the expectations are of you. You'll have a generalized knowledge of what's expected of you each week and what's going to be happening. So let's dive into that. Give me 1 second to pull that up for you. Okay, so let me go back to, I think I just did some recording and didn't have everything I thought I had there. So let's go back. Hold on just a moment. Let's stop the share. And give me just a moment to pull up what I want to share with you. We were talking about the syllabus. All right, so let's go back. You should be looking at the syllabus again. I think we left off with looking at where the grading scale is. Let's go back to grading scale. C or better is required for successful completion of the course. Skills must be 100% successfully completed, satisfactory in the lab. Evaluation and criteria. Your skills are pass or fail. I may have mentioned that earlier. You have 10 chapters that are in the NeuroSafe book that you'll be covering, and it is comprehensive. It covers absolutely everything you're going to need to be successful on your NeuroSafe exams, both written and skills. We look at class participation. We look at major exams counting at 60%. Your final exam is 20%, and other assignments is also 20% for a total of 100% for the course. Your requirements, labs must be completed in full uniform. So on Monday and Tuesdays, you'll wear full uniform once we start wearing uniforms. On Thursday, you will wear the MISG t-shirt. Absences must be limited to 2 absences. Yes, we give you a little leeway for 2 absences, but I'm encouraging you 0 tardies, 0 absences. Schedule your appointments and doctor visits around class. And this class will be over so fast. So try to schedule things around the class. Even though it's listed 9 to 3, there may be some days that we have to be here to 3. But please don't ask me, are we going to be here? How long are we going to be here today? Please schedule yourself to be in class from 9 to 3. And then if you are allowed to leave early, that's great. All payments are due as scheduled on student installment payments. So if you're making installment payments, we will be going over with you your installment schedule, and you have to sign off on that. If you are late for the time that you're supposed to make your payment, there will be a $25 late accruement fee added to your total bill. And that's for each time that it's late. All homework and classroom assignments must be submitted on time. If you're late, then once you come back, then that homework assignment is due the very next day, or else it's late after that. No children are allowed in the classroom or lab area. When present in the classroom for labs, be on time so you can wipe down the area you will be using. All students must pass the final exam with a minimum of 75% or above to successfully complete the course. All skills listed must be checked off before satisfactorily completing the course. If you look at the schedule, this course is 6 weeks long or short. Usually the first week is when you cover the abbreviations, body positions, military time. And week 2, we really start moving very fast into the content of the course. We'll be covering chapters 1 and 3. And then if you look on the right-hand side, we also start working on skills. So when we give you reading assignments, you won't have class periods to read your assignments. That has to be done at home. When you come in, all you're gonna be doing is taking tests, reviewing over your information, and working on skills. You do lecture, work on materials, and work on skills. Week 3, so forth. Week 5, week 6. Week 6, you're gonna be in clinicals. Clinicals are 3 8-hour days from 8 to 5 at a long-term care facility of our choice. And they will be days. Now, there are some options for evening, for my evening students, there are some options for evening clinicals, so that's not gonna be a problem. You just need to prepare for it. Clinicals, as I've said, are always 3 days. And the facility that we use is Lakeside Senior Living. At the end of the course, you will have an option to sell back your book, not your workbook, but at least your book for $20, or hey, you could donate it back to the school. That would help us tremendously, okay? All right, and that is your syllabus for this course. Now let's watch a video that covers the role of a nurse aide in training, so you'll have an even better understanding of what your role is and what we expect of you as a student and as a nurse aide. Okay.
What is a CNA? Nursing assistant job duties and responsibilities. CNAs ensure the well-being of their patients by performing a variety of tasks that help with daily living activities. Because CNAs typically spend more time with patients than nurses or doctors, they understand their behaviors and health statuses. Whether identifying decreased mobility, increased pain, or memory issues, CNAs play important roles in the early detection of symptoms and may identify issues that other healthcare personnel do not. CNA duties. Individual tasks can vary based on where a CNA works and the type of patients they serve, but typical responsibilities include answering call buttons and alerting nurses to emergencies, monitoring patient needs and reporting any issues to other healthcare personnel, helping patients with their daily needs, such as eating, bathing, dressing, and toileting, ensuring patient comfort by changing bedding, filling water jugs, and positioning items so they are in reach, repositioning patients in beds, helping patients move from a bed to a chair or wheelchair and back, assisting with lifting patients from their bed to examination tables, surgical tables, or stretchers, measuring vital signs, including blood pressure, oxygen level, and temperature. Is a CNA considered a nurse? As their titles imply, certified nursing assistants assist nurses and other physicians rather than working as official nurses themselves. That said, CNAs are vital members of the nursing profession. Where do CNAs work? CNAs work in various healthcare settings, including general and specialty hospitals, nursing homes, assisted living facilities, and rehabilitation facilities. CNAs who work in nursing homes deal with elderly patients, while those who work in rehabilitation facilities may care for patients of all ages with various ailments or diseases. CNAs in memory care facilities have the challenge of working with patients who have Alzheimer's disease or dementia. As a CNA, you have an abundance of options. Now that you've gotten an overview of what the job of the CNA involves, there are other things you probably want to know about the career as well. To learn more about the role and job outlook for a CNA, please subscribe to our channel. For CNA, CPR, and instructor level classes in Florida, visit us online at www.fltraining.com. Thanks for watching.
Give me 1 second. Okay. Okay, so let's get back into, all right, so for this course, let's talk a little bit about, I always believe in, let's begin with the end in mind, and make sure we're still recording here. Let's begin with the end in mind. So at the end of the course, once you've completed all of the course requirements, all of the tests, all of your final exam, all of your clinicals, then you are preparing for your state certification exam. The state certification exam for the state of Georgia is two-part exams. There is a skills portion and a written portion, or may I say, a computer testing portion. Your computer exam will be, it's a proctored exam. You can take it here at the school. You just have to put you in a room by yourself. Have all the doors closed, and so you'll have that privacy. And then there will be a proctor online that will be proctoring the exam for your nurse aide. You have to have your driver's license and your social security card, not a copy, but the authentic card. And let me tell you about the nurse aide program. Like if you're, for example, if you got married and your name changed and your driver's license and your social security cards don't match, they will not allow you to test. You may have an explanation or whatever the reason is, they still will not allow you to test. So make sure your driver's license are not about to expire and that they match your social, the names match exactly on both documents. So you will need that in order to test. And then you have to have a laptop that is compatible. So once we schedule you for the exam, there's a systems check that you will have to do on your computer, whether you take it on one of our computers or on a laptop at home, because you can't take this at home in a bedroom or in a room where you have four-wall privacy so you can shut the door. They're going to make you hold up your phone and do a full circle. They're going to see everything around in the environment. So you can take it at home or you can take it here at our school, whichever you prefer. So it will be a 70-question online test. 95% of the students pass it first try. Every now and then I'll have someone who just is struggling with that exam, but for the most part, I would say even maybe 97% of the students pass it first try. Because the book that we use and that you're going to be using for the course is so comprehensive, it covers absolutely everything you're going to need to know. What you have to do is make sure you go through the book, okay? I am not going to teach you every single word. We'll have lecture for every chapter, but you've got to dig into that chapter. And I'm going to tell you what will help you dig into the chapter. You have a workbook, which forces you to dig into the chapter, but you just got to dig. So your workbook has questions on everything in each chapter. It forces you to dig in there and pull the information out. You just got to read through your workbook once you finish answering it. And if you pull it from your workbook, that knowledge, and put it into your brain, you're going to do fine on your state exam. Then the second part is the skills part. We got to order some more, but all of you will be receiving a little pamphlet book like this with the nurse aid skills inside of this book. There's 23 of them, and this is what we're going to be practicing. Now, there are many nurse aid skills, and a lot of them you're going to actually learn those inside of your nurse aid book that you'll be receiving. But the ones that you have to test off of, that they will test you on, are in this little pamphlet book here. Okay. Once we distribute or pass you out this pamphlet, make sure you put your name in the front of it. And it is for you to keep and for you to bring back to class every single day that you come to class. Okay, because you're going to need this. We're going to be using this. It's going to look pretty warm by the time you get to the end of the course, or at least it should. Okay, so you take your skills exam. We'll schedule your skills exam. You won't take it here. You'll take it at one of the testing facilities for the skills. And you have to pay, you'll have 5 skills. And you have to perform, you will not know which 5 skills. So you got to know how to do all 23 skills with 100% proficiency. That means do it without making a mistake. You have 5 skills. One of those skills will be hand washing. And then you're going to need, then you'll have 4 additional skills. One of those skills will be a measurement skill, such as blood pressure or pulse, or measure intake and output, or weight. or respiration. So it's going to be one of the measurement skills. And then you have 3 other skills. And if you can perform those 5 skills with 100% proficiency and get a yes, yes, yes all the way down the road, because what will happen is, say, for this, each skill, it's going to say, did she turn the water on? And the tester is going to check, yes. Did she rinse her hands before she began to wash? Yes. So she'll go straight down the road. And as long as you perform each step of the skill with 100% proficiency, you're going to be just fine. So you pass the skills, you pass the written, they combine your test scores, and voila, you become a certified nurse assistant in the state of Georgia. You will receive your own certification number. Some people call it a license number, but it's a certification number that's good for 2 years, and then you have to renew it. They will mail you the paperwork for you to renew as long as your address has not changed. And you just have to do continuing education hours or send in verification that you worked as a nurse aide and get it renewed, or that you have knowledge about being a nurse aide and get it renewed. Okay, you want to do that before the deadline every 2 years. Okay, so that's kind of a general overview of the nurse aide program and what to expect. I will show you guys in the lab area the equipment that you will be working with. Something else that I'd like to mention to you. First of all, let me just show you the book that you're going to be working in. Should look something like this. They change the books periodically, but it should look something like this. It's kind of thin. You're responsible for bringing that to class with you every time you come to class, because you'll be referring back to different chapters based on what we're working on. I expect to see highlighting in your book, pens where you've written and underlined things because you're really diving into the information. Okay, that's important. And then you're also going to get a matching workbook for the nurse aide program, and you got to make sure you answer all the questions for each chapter, because that's what's going to help you be successful in your with each chapter test. So there's 10 chapters, there's 10 workbook chapters, there's 10 tests. So for chapter 1, there's a major exam for chapter 1. There's also a chapter review at the end of each chapter that I'm going to want you guys to work on too. They're inside your book. If you can successfully get through the chapter review at the end, you're going to be great on the chapter exam. Okay, so I expect you to work very, very hard to get through your assignments. Your syllabus tells you where we are, what we're going to be working on. So every day when you come to school, we're going to meet in the big classroom, everybody, for a general overview and announcements for the first 5 to 10 minutes. And then you will break out into your individual classes to do your own assignments, and we'll start the video for you each day as well. Okay. Let's see. You all are also going to receive, along with your syllabus, you're going to receive a skills checklist. Let me see if I can find that for you, because that's very important. I want to make sure that you know what's expected with that. Okay, so what I was going to show you is, let me go here and I was going to show you the skills checklist. That is very important, and all students have to have this. Let's go back to page 1 of this sheet. Skills checklist. It is a federal and state guidelines core curriculum required skills checklist, and there's several columns. The first column, lab practicum, instructors, initials, and date. I'm going to need you to put dates down by everything in this first column. Dates in between, because we're going to cover all of it. Sometimes it gets confusing with keeping up on what day we did what. But here's what I need you to know. I need a date, a class date by each of these skills, even if it's something you read in your book or saw on a video. We're going to need class date down by the first column of every one of these skills. I'll take care of the second column. You're just going to put dates, and I'll come back later and put my John Henry initials out by each of those. But this has to be in your file. It's a state mandated skills checklist that has to be in your file. So without this, I will not schedule you for clinicals, and you cannot complete the course. So if you forget this, we will not send you clinicals. So you will get a copy of this. Each of you is 7 pages front and back, and a very, very important document. Okay? All right, that concludes our overview for today. Thank you so much for your time, and we will see you later.